Okay, so welcome everybody and thank you for joining us today. It's lovely to see so many colleagues in one place. For those of you who don't know, I'm Harriet Phelps-Knights, head of Janet Duke Primary in Basden, and I'm also the EPHA chair, so hence why I'm chairing this meeting today. We currently have 107 participants now joining us, much to Pam's delight, I'm sure. And Pam's going to continue letting people in as we go through. So the format for today is that Matt Butler is going to give us some information about what he knows about COVID so far and thoughts around how we can effectively manage our schools now and perhaps in the next few months. And then Nick Hutchins, where are you, Nick?
I'm here. If I talk, I'll come on the screen probably.
Thank you. He's going to curate the questions for us. So Nick, would you like to introduce yourself?
Yeah, hello, I'm Nick Hutchins. I'm the Vice Chair of EPHA in Hamilton Primary School in Colchester. And my job is to try and pick up any questions you guys have. If you add them to the group chat and send them out to everyone or direct to me, better on everyone really, because Pam will be able to download the transcript of the chat, and we'll try and group the questions together, and I'll ask on your behalf when Matt gets to an appropriate sort of pausing point.
Thank you. Pam's going to be hosting the meeting and managing the technology, so good luck with that, Pam, and God help us all.
Thank you for your confidence, Harriet. Very helpful.
Are you going to say something, Pam?
I'm just a reminder to everyone that we are recording. You might find, I've just put in the chat, you might find speaker view is your best view to focus on the main person speaking, but that's up to you. I'll use that view for the recording. Following the webcast, we'll clear the...
Pam, you're on mute.
I think I've done this before. I was just saying that I'll clear the recording with Matt and then we'll make it available to everybody.
Fabulous. Thank you. Thanks, Pam and Nick. I'm going to introduce Matt Butler, who you may have seen on previous webcasts, which have been run by Simon Kidwell and Dan Thomas. So thank you to them for supporting Pam in setting this up and putting us in touch with Matt. Yeah. So Matt, would you like to tell us a bit about yourself, and then I'll start you off with some topics that we might want to hear about.
Yeah, so hello everyone. So I'm Matt Butler. I'm one of the consultants at Addenbrooke Hospital. I finished doing coronavirus work about 2 weeks ago, but for the whole period of the pandemic, I was manning the respiratory assessment unit, or the COVID assessment unit, at Addenbrooke Hospital. At the peak, we were seeing about 5 patients in every shift, so every 12-hour shift. So, and on one day, I think every single patient on the ward had coronavirus. Thankfully now we're in a much better position than we were then. We're seeing around about 1 or 2 patients come in, maybe every other day, but certainly we're well past the peak of the pandemic, and it's been a really interesting as a clinician disease to sort of follow. But my main task that I set myself when we first were going into this peak was basically on staff safety. Hence why I've been sort of involved after our main involvement in teacher safety. So I got into a conversation with the head teacher at my primary school, Milton Road Primary School, and she initially promised me it was going to be a meeting with a small set of head teachers, only a handful she described it as, just to talk through the reopening, and that led to the first Coronacast, which I think has been viewed over 70,000 times. So I was duped, you might say, into my involvement with head teachers. But it's been a real honour and a privilege to sort of help you get a bit get more set up into what you need to do within schools in order to protect your staff. Because as I've always said, it's not pupil safety that you want to be focusing on, although that is important in protecting staff. the most important thing is focusing on how to keep teachers and head teachers and all other adults that are coming into the school safe, in order that you can then effectively teach the children. So we're currently in a much better place with the pandemic. The last week of data that I saw showed that although there had been outbreaks within schools, bearing in mind an outbreak is classified as 2 or more people with the same symptoms, there'd been 24 outbreaks, I think, in week 24, so that was a couple of weeks back now, located on schools. Given the number of pupils that are now back in school, that is still a very low number, and actually is exactly the same number of school outbreaks that were happening in the week before the 1st of June reopening. So we haven't seen any great increases, but the data, there's always a bit of a lag, so we'll have to just keep an eye on the numbers and the figures, because I'm sure there will be more outbreaks and more sort of localized need for action. But I think I'll pause there just after the summary, and then you can fire away. I want to leave as much time as possible for questions. So I'll hand over, and you can fire away.
Thank you. So we've got about 8 different topics that I know Pam sent through to you, but the first one was around developing our understanding of the COVID-19 and the pandemic, which I know you've just sort of said a bit about, but if you could give us a bit more information around that.
Yeah, so the COVID-19 is the disease. The virus is SARS-CoV-2, which was first isolated in December in Wuhan. It's one of 7 coronaviruses. You'll have all been infected with coronaviruses throughout your adult life, because the first 4, the lower severity 4, are the ones that cause the common cold. One of them in particular you can get about 1 every 2 years, so it's very prevalent in the normal society. And then in the last couple of decades there have been 3 quite devastating coronaviruses. SARS, which you may have seen, started in Asia and then went over to Canada and had quite a high fatality rate. MERS, which is the second newest coronavirus on the block, which is Middle East Respiratory Syndrome, which started in camels and is focused, obviously, given its name, around the Middle East and Dubai. And then this one, SARS-CoV-2, which has been renamed as the disease COVID-19, 19 being the year in which it was first identified. Mainly spread through respiratory droplets. So what we know more recently is that actually you don't have to be coughing or sneezing in order to spread this quite widely. Some of the largest outbreaks have actually been in asymptomatic patients or people that have spread it through singing classes or choir practice, for example. So hence why a lot of the focus on reopening and reducing the lockdown now is around trying to reduce those sorts of transmissions. So churches are allowed to go back, but there aren't going to be any singing in churches for that reason, because as you can imagine, if you're singing, your vocal cords are vibrating at quite a high frequency, and you're also breathing out fairly rapidly. So that can spread the virus quite dramatically. And as we understand more and more about those sorts of things, of how it's spread, you can design better and better working practices. So for example, offices have completely changed within the hospital in their configuration. So we used to have 2 desks together where we would be looking face to face, whereas now we've moved them all against the wall, and so we all have our backs to each other. And it's little things like that that can have a big impact on reducing the transmission. The other main route of transmission, and we'll get on to cleaning, is on surface spread. So just like if you breathe out the virus, and then someone else inhales and breathes in the virus and gets infected, if your exhalate lands on a surface, or you cough and sneeze and it lands on a surface, and then you touch that surface, that's another way of acquiring infection. Hence why you'll have heard a lot about hand washing, why you'll have heard a lot about what sort of clothing, what sort of equipment people need to wear when they're seeing patients with coronavirus. Also, in your case, pupils with suspected coronavirus, what sort of kit you need to wear, and we'll come on to that. But the key thing will be a lot of the people that that are in schools will have it, but you won't know about it, and so you just need to be really vigilant with regards to surface decontamination.
Thank you. So is there any more around what primary schools can do to manage and minimise the impact of the virus?
So I think a lot of what has been done with regards to the first 3 years that have gone back, so namely the restricting the size of the bubble initially to 15 when we had more cases in the community, limiting the number of people going in and out of a bubble, ideally no one going in and out of a bubble if they don't need to, and where they do need to, taking other strategies to sort of minimise the chance that they might bring infection into a bubble. Because remember, the whole reason of a bubble is to contain infection were it to get there, so that it doesn't then spread to other classes within the year group. I think the key thing, and I think as has become clearer with other countries, so we've just seen what's happened in Germany, we've seen what's happened in Iran. I hate to say this, but I can't see us not having a second wave in winter, because I know how this coronavirus spread last winter, particularly in China, and it was probably circulating in the UK in January, a lot earlier than what we thought it was circulating. And I think anything that you do now, even though it's beautiful sunshine now, you need to make sure that it's practicable in winter time. So there's absolutely no need in pushing all your classrooms out and having outdoor classrooms if you can't do that in December. And December will be the peak of the second wave, were we to get it again, because naturally it takes a bit of time for it to build up. I think that it will inevitably happen that the bubble size increases, and I wouldn't necessarily see that as a bad thing, because obviously as the virus is spreading less and less in the community, you need to take less and less severe measures, just like we're doing in general social distancing, reopening pubs and bars, reopening cinemas. As there are fewer cases of transmission in the community, the chance of you meeting someone that has coronavirus is less and less, and therefore the restrictive measures that you need to take in order to prevent spread of infection become less and less as well. So I think the bubble size will increase, probably back to normal class sizes, but I think you will be still living with bubbles for the foreseeable future, and unless we got a vaccine that we could deploy on a wide scale, and talking about millions and millions of people globally, which I think is going to be very difficult to do initially because you're just not going to have the manufacturing capacity. We are going to be living with this for many months, if not years, and I would certainly my guess would be that it's going to be well into 2021 that we're going to have to keep a handle on this. So I think bubbles are here to stay for now. So cleaning also needs to be practicable and workable going forward for at least the next year or more. But also thinking about your staffing and planning ahead to having sort of fewer adults potentially cross-contaminating within bubbles. And obviously that's difficult because we don't have an endless supply of teachers, just like we don't have an endless supply of doctors and nurses. But whatever you do, you need to think ahead and plan ahead that this needs to be a long-term solution.
So what would the effective cleaning look like?
So I've always been when I've been asked this question, it's usually come with how often do you need to clean? And I think the answer is there's never enough cleaning, because obviously if someone is asymptomatic, potentially they could be continually contaminating surfaces, but whatever does happen needs to be practicable and workable. So if you think about the mitigation for risk, if you clean once in a day, that's so much better than no cleaning at all. Twice a day is better than once a day, but by the time you get to 3 times a day, 4 times a day, the actual sort of gains become less and less, because the chances of each individual surface becoming contaminated in that interval period become less and less, and therefore and also it's not workable if you've got children in the classroom all the time. The key surfaces that you need to focus on are the high touch surfaces. So if a surface is going to be touched frequently by a child, can that therefore be limited to that child? So I'm thinking of things like their actual stationery, the scissors and things like that. if they can't be limited to an individual child, can they be limited to an individual set of tables, so that they don't then have the risk so much of cross-contaminating. And then just cleaning as much as you deem. This thing is killed by simple detergent, so you don't need to get all fancy and use hypochlor or anything like that. Just simple detergent, soap and water, warm, because it will break down the fatty layer of the virus better. And then just do it as regularly. And I've always said get the kids involved with doing these things. At my kids, when they were at nursery, they had eco monitors that would always make sure that the lights in the bathroom were switched off, and that the sinks taps were turned off, and they would help with cleaning and sweeping up at the end of the day. Because it is important that if this virus is here to stay for the short and mid-term, that the kids actually realise and learn about how infections are transmitted, because this is not the only pandemic that's coming. That with global air travel and higher human populations, we're going to see these sorts of crises, these sorts of infections happening more and more frequently. So certainly it should form part of your active teaching about how to mitigate that risk through decontamination and cleaning, and the kids should be involved in that.
Harriet, can I jump in there? And Matt, can I jump in with a couple of questions that have come through the chat? Is that okay?
Yeah.
Matt, I'm going to go first with a sort of shielding set of questions for staff, if that's okay. So one is around pregnant staff in their third trimester. It's advised they should completely shield. Do you think it's likely that the advice will be, what is the likely advice in September, do you think?
Yeah. So I think there's going to be big changes to shielding. For all of those people, there may be some on the call that are shielding. I think it's been a huge sacrifice for them to shield. I think as we have learnt more about the risk groups, there will be some people that are in the shielding group that we now know are less of a risk. So with respect to pregnancy, the reason that we always take pregnancy and put it into the shielding category is not necessarily because we had evidence that they were more likely to get severe disease, but anyone that's pregnant will be able to tell you that they are more likely to get infection per se. So they probably are more likely to get coronavirus, but there isn't any evidence that firstly it affects the fetus in the third trimester that I've seen. So it's not like Zika that was circulating in South America that had quite devastating consequences for the unborn child. So we're not in that territory, but because it's an unknown and we have only had this since December, we can't really make any assumptions or any assertions for those that are sort of in the earlier stages of pregnancy. So they will probably still be continuing to shield unless we get to a situation where community transmission is so low that it's going to be very rare for someone to meet someone that's infected and come less and less. So even if they're shielded, I suspect that they'll be able to meet more people, they'll be able to meet in more groups. Even now, they're by August, I think it is, they're going to be allowed to meet other people indoors. And as the virus becomes less and less, that will obviously loosen even further. But I think by September, unless we are already within a second wave, I think that they would be allowed out. Obviously, if they're in the third trimester, they might not be coming back in September because they might be on maternity leave. But I think there are big changes coming to the shielding population. Yeah.
Okay, great. Next question is one around cleaning, really, Matt. Is there a safe way to share laptops which are tricky to clean in between and will be a high-touch surface?
So you can get laptop wipes. So anything that's slightly damp that you can move across the keyboard will take the virus away. And if you did that twice, that's better than once. If you did it 3 times, so you can get. So certainly, I've seen laptop screen wipes that you can use over keyboards. It depends on the type of keyboard, because sometimes the actual keys, that there's sort of little gaps within the keys, and there is potential that if you are tapping away and there's a gap between the keys, that can generate dust that could then fly up. Or if you are having to I suppose if it's laptops, you can't really do this, but if it's a desktop PC, can you take your keyboard round? Certainly what we've done in our own offices, if we hot desk, is we take our keyboards with us and we take our mice with us, so that you each have your individual one. If you can't, then clean them. But certainly just a dampish cloth screen wipe that you wipe over the surface will take away the majority of the contamination.
Okay, that's great. Now, a couple of bits around spreading the virus, if that's okay. So I've got a group of questions that sort of talk around asymptomatic children and singing. You know, as children are sort of asymptomatic, is singing going to be something we can do in primary schools? Because you do quite a lot of that.
Yeah, so my own view would be no. I think that the thing with children is, what we know is that even when they get it, we don't know that they have it because they're more likely to be asymptomatic. And of those that are asymptomatic, although they likely form the bulk of people that are infected, and therefore the bulk of people that then spread infections, I think we can almost say for certain that if you are asymptomatic, you are less infectious. The thing always with singing is that you've got, if it's a joint activity, you're not doing solo singing, so everyone is singing all at the same time, and presumably they're all going to be singing towards the teacher, which I think is not ideal, because the respiratory droplets that you expel when you're singing can go many meters. So we're even beyond the 2 meters social distancing here. We're sort of talking up to 8 meters. I've seen some studies show that it can be projected. So I would avoid it, or get the teacher to stand behind the kids. If they're singing outside, the risk is very low. Standing at the side of the children is much better, getting them to sing away. I think when you get into the point where you're thinking of doing an activity that is higher risk, and then you're thinking, should I be wearing a face shield? Which, if you were standing in front of a classroom of singing teachers, I'd sort of say, yes, you probably would want to. Then you're thinking, well, actually, is it worth doing that way? And is there a different way that you can do it? So singing outside, I think that's fine if the teacher's to the side of the kids or behind them, and definitely above them. Because remember, respiratory droplets will, to the large extent, arc down from the height of the children. So as long as the teacher's above them, which is, I think, why actually there's very few cases of pupils infecting teachers, because I think the height difference is quite key. And also, obviously, then the distance between the teacher's mouth and eyes, where they could pick in puff infection, is more than maybe 1.5 meters away from the child. So I'd probably say no to singing in a very sort of close environment, indoors, no ventilation, which you're probably going to experience in December because you're not going to want all the windows open. But possibly yes now in a low prevalence environment, outside with the teacher behind or to the side.
Okay, Matt, a final sort of set of questions really before I jump back to Harriet. This is all around more people taking bubbles. So you've talked about bubbles being around now for quite some time, and schools in their management and organisation use different people to cover various different bits. So could you talk us through your thoughts around whether or not we should be using different teachers to cover other teachers in bubbles, or whether we should avoid that?
So I think because it's unavoidable, you're going to have to do it, because there's you're going to get staff that get sick. You're going to have you're going to have adults for some. Maybe they need to do a special needs assessment or something within that bubble. So you are going to get adults that are not that regular bubbles teacher needing to teach or to provide a service within the bubble. So because it's going to happen, I would see it as not a yes or no. Obviously, avoid it as much as possible, but and therefore, if you avoid it as much as possible, the risk of anyone bringing in infection is mitigated that way. If they have to come in, then perhaps think about other mitigation measures. So, say if an adult was coming in purely to see a single pupil, then could that be done somewhere else? Could that be done in a different room so that adult doesn't have to actually come into the bubble, in the main bubble? The other thing to say would be, if you do have to do that, could it be done? Could that be a lesson that maybe is delivered outside, or certainly if you had the space, could it be done in a bigger space? If it was going to be, say, a supply teacher for a whole week, my boy is his lesson is actually in the hall, and they've put lots of benches round to sort of mark off a bit within the hall as their classroom. So if you had that sort of space and a supply teacher was having to come in, could the whole class be relocated so that were that teacher to have infection, that the risk that she would then pass it on to the bubble, and therefore that the bubble then pass it on back to their regular teacher when she returns, is mitigated. So because it's going to happen, just mitigate against it and take measures. The other thing I did say, and I don't know whether when you actually go up on the bubble size or reduce the distance between pupils and teachers, the other thing might be face coverings. I'm a big proponent of face coverings. I think we should have done it a lot earlier, and I think had more of us in the general public been using face coverings, I think the pandemic would have been less severe. But certainly, I think schools thinking about whether or not the teachers, and I think teachers in France are using face coverings, whether if a teacher comes in to a bubble because it's unavoidable, could they use face coverings in order to prevent the chance that they could introduce infection into that bubble? And then that makes it safer when your teacher, then the regular teacher, returns into the bubble, that then the children haven't acquired infection and then can spread it back up to the teacher asymptomatically.
Thanks, Matt. Straight back to Harriet then.
So following on from that, is there any other PPE that we should be using in school or you would recommend?
So I think because the risk of anyone having it and the risk of therefore picking it up is so low at the moment. I mean, I think I heard on the latest research that it's about a 1 in 1,500 chance of you meeting anyone that has infection. And that will be about 10-fold lower in children, probably because they're less likely to have it and less likely to be infectious even when they do have it. So because the risk is very low, you don't need to wear face shields and masks that I wear if I'm seeing a positive patient. Certainly you would if you suspect that a child in front of you has coronavirus. So what I'm talking about now is day-to-day PPE, and then I'll talk about if you've got a suspected case. But certainly all your measures to do with what I do are behavioural measures. So social distancing, hand washing, because remember, this thing doesn't only goes through your mouth and your eyes. It isn't acquired through skin. So your skin is your PPE. And so long as you clean your equipment, which is your skin, then you won't then cross-contaminate your eyes or your nose or your mouth. So obviously that then doesn't stop respiratory droplet transmission, but then if standing above, distancing away, avoiding high risk activities that we've talked about, singing, that then is your other preventative measures. If you've got someone in the school that has told you they've lost their taste of smell or taste, and they've got a fever or a dry cough, and I would almost say, in addition to that, if they're and also temperature, if they're unwell for any other reason, so they might have just developed diarrhea or vomiting, then I would be very cautious that child might potentially have coronavirus, and you should have a limited supply within schools of face masks and face shields. And I can certainly send you a link on how to properly take that off once you've worn it, because the key thing why PPE is not advocated widely is because you're more likely to do yourself harm by taking off contaminated PPE incorrectly than not wearing PPE in the first place. So certainly if you were to wear it, you need to make sure that you know how to then take it off in order to avoid contaminating yourself. But in general day-to-day life, it's all the measures, and don't see yourself as unprotected, because actually the biggest protective measure is distance. PPE is not fully effective is the other thing to remember. PPE, so we know in healthcare, so even with all the gubbins that I've been wearing, around about 3% of healthcare workers have infection at any one time. So between 1 in 50, 1 in 30. And in the population as a whole, it's around about 1 in 2,000, 1 in 1,500. So even with PPE, we are still acquiring infection because this thing is just so infectious. So distance is the most important measure.
Thank you. And I think the link to effectively taking off would be brilliant if you could send that through to Pam.
Yeah, it's on COVID-19ppe.org.
Oh, okay.
Yeah, it's the website we set up. Well, actually, my neighbours set it up. So it's COVID19ppe.org, and if you it asks you to say you're a healthcare professional, just click consent, and then just go on to primary care, and then it will take you through the whole rigmarole, and you'll see why we don't advocate everyone wearing it, because it takes about 5 minutes to take on and put on and take off each time. But yeah, that certainly would be worthwhile. You just having even just to catch up, if you're in it and you want to know how to take it off, just watch it.
Thank you. And so, having talked a bit about PPE and sort of safe practices, what would you advocate adults in schools to be doing? You said a bit about standing above children, things like that.
Yeah. So I think with the big sort of subtitles on this, anything you do, you need to be able to replicate in December. But increasing ventilation to all your classrooms. So the first thing that anyone should be doing, the first person on site in the hospital should be opening all the doors, all the windows when the weather permits. Any classrooms that you can do outside, distancing between teacher and pupils. Don't worry so much about the pupils, because they will do what they like. Obviously try and maintain it as much as possible, but we need to also teach, and I think the thing is, we're going to have to teach in an environment where COVID is going to be around for a long time, and therefore we're just going to have to manage as best we can. You will get kids that will have a bit of rough and tumble, and you can't then, obviously what you don't want to do as a teacher is to go and try and pull them apart to say you need to be distancing, because that's obviously putting you at greater risk. So just let the kids almost get on with when it all gets out of control. Don't put the teacher in a position whereby they're not able to maintain distancing. Thinking about December, obviously it's going to be a lot more difficult to have outside classrooms when it's cold and wet and potentially sort of snowy, sleety, whatever. But now's the time to be sort of thinking about, could you have open-sided marquees with outdoor heaters in order to facilitate some outdoor classes? Because particularly if you get a lot of, and I think the distancing will be reduced to maybe a metre in schools. If you get a lot of children within the classroom, sometimes it would help to have that outdoor spill out space anyway. At Milton Road, they have some covered spaces which they can obviously use, so they have some overhangs, but outside of the classrooms, which you might also be able to double up as sort of outside classroom space. I wouldn't. I was asked previously on a cast about whether or not you should be investing in these UV wands, which you can scan over surfaces and kill them. Don't bother. It's a waste of your time and effort using them. As I've said, just general surface decontamination. And the main two things that you need to then perpetuate are distance and bubbles. And so long as you can do those in December with a full school, then you're on to you've already won half the battle.
Thank you. Nick, are there any other questions around that?
We've got a couple that come in, Matt, if that's okay. So firstly, I suppose we'll go to the one, somebody's asked a question in and around the seriousness of the virus. So could you just clarify how serious it is statistically if you get it, and then specific groups that are at risk, please? Yeah.
So that's an excellent question, because I think the one thing, and it goes back to the shielding question, is that we haven't really, as a country, been given the data and the knowledge about actually what the individual risk is. So I am 37 years old. I have no medical problems. My risk of dying from COVID was equal to my risk of dying from everything else this year. So effectively this year I had twice the risk of dying, but my absolute risk of dying was very, very low anyway. So it might have been 1 in 200,000, because I could have walked across the road and someone knocked me over and I split my head open and I died that way. So my risk has doubled this year of dying, but the initial risk, so what my absolute risk is very low. If you are young, fit and healthy, and I think most teachers are in that group, then you are in a similar position. The biggest risk factor over and above anything else that you hear about pregnancy, Black and minority ethnic, comorbidities, the biggest risk factor is age. So your older staff, and if you have staff that are close to retirement, they are your highest risk group, irrespective of what everyone else has. Because what we know is that as you go into the decades of your age, the over 80s are the biggest risk. They form half the deaths in this country, and they only form 5% of the population. So age is the number one risk factor, and then obviously if you have comorbidity, so if you have other medical problems and potentially from another Black and minority ethnic group, then obviously your risk is also higher. But the number one risk factor is age. As we know more and more about the virus, we understand that more and more people have it that we didn't know had it initially, and so the death rate comes down because you identify many more asymptomatic cases. So when you were looking, if I were to get infected, if the question was what is my risk in total, I would say if you're young, fit and healthy, it's about the double the risk. For children, it's interesting, they seem to only be at quarter extra risk. So obviously children have a greater risk of dying actually than most 20-year-olds anyway, because of accidents. So they're more likely to catch themselves in curtain loops and things like that. So actually children have a higher risk of dying than people in their 20s, 30s. But their extra risk from COVID of dying is only about 25% extra. So they do seem to be getting it a lot less severe. But obviously the key thing about schools going back is that they need to do risk assessments for all of their teachers, that maybe even if they've not been shielding, they may be in a higher risk group. And if you identify someone as being at moderate risk, then taking measures to try and minimize their own individual risk is still key, but the absolute risk to any one individual is very low at the moment.
Thanks, Matt. Just a couple of bits that have come in and around, I guess, again, just revisiting a bit of spreading of the virus, just a little bit of advice really on exercise books, textbooks, and marking them and taking them backwards and forwards from home, and reading books, because again, they're high touch surfaces, and some advice in and around that, please.
Yeah, so textbooks, if they have a shiny cover, then that's fairly easy to wipe down and decontaminate. Obviously, if it's paper, I think the best strategy that I've seen is just putting them in quarantine for 24 hours, 48 hours, whatever is doable. So I know certainly at my school they would generally take in homework on a Friday. Maybe the teacher only opens that up to market on Tuesday, for example. If they didn't need to, the longer you leave it, the less likely it is that it has contamination on it. The other thing to say about that would be maybe when if you are setting homework, can you try, now that we're all doing all this distance learning, can you get family members, if they were handing in work, can it be scanned in? Can you take I know that's a bit of a pain because my brother's a teacher in an academy, and he has spent a lot of time when people have sent him 50 JPEGs of their essay, and he's had to load up each individual photo. So can you think now, before December, how people can submit work digitally, because I think having textbooks, obviously it's useful, but for the teacher to see the working, it doesn't necessarily have to be in the paper format. But if you have to do it, then maybe keep it in quarantine for a bit longer. And then I saw just a question pop up on there about, are children over 8 at greater risk? The actual jump in risk, the big proviso to all of this is that the under 20s we have very little data on, so they haven't been tested in any great numbers. But when they are tested, they look to have been getting infection, but they certainly aren't at much of an increased risk under 20. It's over 20 is the key risk. I suspect there is probably a little bit of an increased risk if you over 8, like anything, it's going to be a spectrum, but the absolute increase in risk from 8 to 20-year-olds, I don't think it's going to make a significant difference. The big jump comes from sort of 60s up to 70s, up to 80s, up to 90s. That's when it really takes off. Up until that point, it's fairly flat.
Great, thanks, Matt. Those are sort of the main questions that I've got coming through at the moment from the chat. Harriet, do you want to pick up some more?
Yeah, so I suppose we sort of then come on to what the future might hold, and how might we keep our staff and children safe going forward, really. I know you don't have a crystal ball, but...
As I've already alluded to, unless we get, and I am very hopeful with we've got the best minds in Oxford working on this, on a vaccine. I think even if we get a vaccine, because children aren't actually that, they're not deemed to be super spreaders, unlike with flu, so they're not going to be vaccinated first off, and therefore teachers may well be if they're in a higher risk group, but I don't think that even teachers are going to be first in the sort of the queue. I think probably what's going to happen is healthcare workers get vaccinated because we know that they're getting infected and spreading it to patients, and obviously people in hospital are at higher risk. So I get a vaccine for flu every year, not to protect me, but to protect my patients, and I think the same will happen with the COVID vaccine. The other thing to say is I think shielded people and older people will also be the priority groups for vaccination. I don't think we're going to be able to vaccinate enough people to get herd immunity, because obviously, as I've already said, the over 80s, which will be first in line, probably only form 5% of the population, and you need around about 70% of the population to be immune in order to get herd immunity. So we are going to be living with coronavirus for a long time, and the thing which you need to prepare for is an outbreak in your local area. So you need to know where the virus is in your local area, and I think we are getting better at telling head teachers and telling councils that where infection is. We're getting less and less precious about who has access to that data, and therefore schools will be in a better position to be forewarned as to whether or not, say, the next school in their catchment area or wherever has infection. So I think being aware of what the symptoms are is going to be key. Being aware of what to do if someone does develop symptoms when they're in hospital, if someone in school, when they do get symptoms, being really slick at getting them tested, because you're in a bit of a grey area when until they get tested as to what to do. And then also to remember, if someone definitely looks like they have coronavirus and the test says they don't, that doesn't mean that they don't have coronavirus. The test is actually pretty poor. So if you were very sure that someone had symptoms, you certainly wouldn't want them coming back in. And depending on how they presented, if you say got a call from their GP saying, actually, I still think the bubble should isolate because I'm fairly convinced they still have coronavirus even if the test is negative, then I would take the GP's advice. And overall, any national guidance that you get that says, oh, if the test is negative, the bubble goes back, that wouldn't be safe if it was felt that they still posed a risk. All of this is a dress rehearsal for winter. I can't stress that enough. Whatever you do, you need to prepare for that. And then looking beyond the winter, where are we going to be 2021, 2022? If we don't get a vaccine, we will eventually develop immunity to this. I talked about one of the coronaviruses that causes the common cold. That was felt to circulate initially in the 1890s and caused probably over 1 million deaths, although, as you can imagine, record keeping back then was less good, so we can be less sure on what went on with that particular coronavirus, but now we do see it every day. We don't see it in hospital because it's our own bodies have adapted to it, and it now just causes the common cold. So this coronavirus will eventually do that, but it will come at huge cost to society, because either we just hold our hands up and say, okay, we're not going to get a vaccine, we've got some treatments but they partially work, we can't live in lockdown forever, and therefore we've got to just allow some people to get infected and to build up herd immunity. We may, if we're in that situation, then unfortunately many more people will die, because we do know in the UK around about 90% of the population still have never seen this virus. If you're thinking of London, it's around about 90% have not seen coronavirus, this SARS-CoV-2 virus before. In the east of England, where I am, it might be even sort of up to 93% of people that haven't seen this virus before. So there is a huge capacity in the population for this thing to just take off again, and for us to be back in the situation that we were in March and April. Obviously, that's less likely now, given the beautiful weather that we've got and the fact that people can be more outside. But I do worry about December, and I would prepare for the fact that we might be back to square one back in December.
Okay, that doesn't sound too good then for us, does it?
If you speak to I'm the pessimist in my family. My wife is generally the optimist, but I hope none of that will happen. But I think hope is one thing, preparing is another. And I think if you fear the worst, then you'll prepare for it. And I would really, and I think one of the big things that I think we need to do from a national perspective is really examine what went wrong the first time round, in order to make sure that whatever we need to do, were it to happen in the winter, that we have the ability to do it. I just think we've bumbled through this a lot, and I think if I don't want to make you fearful, well, you will be fearful, but I think from that it needs to generate a pragmatism about, okay, so this thing isn't going away. We can't just sort of hope that it isn't going to happen. If we do lots of things in preparation for winter that we never have to employ, hopefully you'll get the money back. I wouldn't hold out much hope that the DfE is going to dish out lots of money to you for spending on things that you don't necessarily need, but in the end. But ultimately, it's keeping your staff safe, and individual schools are the ones that are having to shoulder the burden of keeping their staff safe, not the government. And I think you just need to be happy that what you are doing come winter is going to be able to keep people safe, because they're important, but mainly staff and other adults within the school safe.
So when you talked before about sort of quarantining paper and things, is there a finite time that the virus stays live or infectious?
Yeah, so it's definitely so it can live on surfaces. The shinier the surface, the longer it lives for. These are very crude estimates, because it's, if you imagine, the only way to prove that a virus, how long a virus can live on a surface, is by getting someone with the virus to expel onto a surface, and then in laboratory conditions, then expose that surface to many people, and then see who get infection. Now, obviously, that's not ethical. So knowing the data on this is very difficult. It probably, the best estimates I've seen, it probably lives on glass for up to 7 days. Paper will be a lot less, because it dries the virus quicker. So maybe a day or more on paper. Clothing maybe a little bit less. So this applies to staff's clothing after, say, working, that if they can't clean their clothes. And I certainly wouldn't say to people, be so OCD that you have to clean your clothes after each time you've been at work. But obviously, if you do that anyway, then that's fine. And if it makes no harm to your clothes or to your day-to-day schedule, then do it, because it's obviously got no real negative connotations. But otherwise, just put things into storage for a couple of days, and the chances of you then picking up infection is going to be a lot lower.
Thank you. Okay, Nick, do we have any other questions?
We've just got a couple that have come in really at the end there around teachers or members of staff testing positive, and then how likely is it that they will get it again?
So I think it's probably not likely that they get it again, although we don't know. So I think the best model for this is the original SARS infection. We think that people were immune for around about 7 years with SARS. Now that's the people that got really severely sick. So if you have maybe a fever, dry cough, and you're laid up in bed for a week, then potentially you might get a couple of years immunity. There is no case, and despite what you read, there is 0 case of anyone getting infected again. as I've already alluded, the test is rubbish for this virus. And so what we've seen is that people can test negative and then test positive again. That's because the negative was what we call a false negative, and it was inadequately reading as not them not having infection when they still did. So there is no evidence that someone has acquired the infection again, but then we only have had this infection for 6 months, since December. So if you're immune for 6 months, and then it wanes, you can pick up infection at 7 months. We'll only know that in July. So we don't know how long you're immune for. So I think the chance of you getting it is low, but we don't have the evidence that we can say that's for sure at the moment. But if it behaves just like SARS did, you probably get a reasonable amount of immunity.
Thanks, Matt. Just a couple more questions around spread, really. So it's things like, would you advocate staggered start and end to school and staggered break times still at the moment?
Yeah. So I think anything like that you're already doing, you should continue to do. And if it isn't going to be difficult for you to continue some of the measures, even if the national guidance says that you don't necessarily need to do it, if you judge that actually it's part of your day-to-day routine now, and you still want to stagger ends and starts to school, then I'd say to continue doing that. The bubbles, I think, are definitely here to stay. And adult segregation, so parent segregation, is going to be going to have to continue for some time. I'm going to just have to go because I told Pam earlier I'm seeing my grand's not very well, so I just need to go and attend to her. But I can always do another one of these if anyone asks any questions afterwards. So I could email Pam a short sort of follow-up video or something. Is that all right?
Yeah.
Yes, fabulous, Matt. Thank you so much for all your time, especially under these circumstances. So we really appreciate it. Thank you, and we wish your granny well.
Okay, thanks very much. Bye-bye. Bye-bye.
Harriet, one of the things that we can do, or I will do, is make sure that any questions that haven't been addressed, I'll forward to Matt, and then I can share any responses from him following up from the meeting, and obviously we'll do the recording as well. Okay.
Yeah, definitely. So I just think before we finish, if there's anybody who has got any further questions.
Yeah.
Harriet, could I just start? Oh, sorry. It's Joe Barclay, and sorry, I only joined about 5 minutes ago. I've been in channel panel. But was there anything that came up in terms of safeguarding that have any implications for us that we're not already doing or haven't already thought about?
No, I don't think so. It was sort of predominantly about keeping the bubbles, trying to avoid contact outside if you can. Pam has recorded it, so once it's been cleared with Matt, she'll forward that recording on, and then you can pick things up from that.
Right, I will.
If you've got any specific questions, if you want to either give them to Pam or put them in the chat, and then we'll get Matt to answer those, and then we can send that out to everybody.
As Matt said, if people would find it helpful to have another session with him, possibly even in September when we're in a different phase, we can certainly set that up. He's been really generous with his time and is very happy to run these Coronacasts and talk to us. So, and also to act as an advisor. So if anyone has any questions in between times, do send those to me and I can get responses from Matt.